Hello, I'm Agboola, Warwickshire's Director of Public Health. I have been doing a series of videos recently to help to address some of your questions around how we can work together to control the coronavirus as we move forward in our recovery journey. I know that many of you will have children who are due to start back at school next week. While this is a really important step that we need to take for their education, including their physical and mental well-being, I appreciate that this will raise some concerns amongst you as to what will happen should there be a positive case at their school. I hope this will help you to understand the process and to see how closely we are all working together to manage the risks related to reopening our schools to all year groups to a minimum. There are three main things we can do to reduce transmission within schools. The first is about avoiding those with symptoms, the second is about getting tested, and the third is about isolating contacts with positive cases. The most important thing we need to do is to prevent coronavirus transmission within schools. It is therefore important to keep your child at home if they are unwell. If anyone in the household is unwell with symptoms suggestive of coronavirus, do not send your child to school until they have been tested. The second most important thing is testing. If your child or anyone in the household is showing coronavirus symptoms, please get them tested immediately. If you're not sure it could be coronavirus, get a test. If in doubt, test. Anyone with coronavirus symptoms should test negative before your child returns to school. Finally, we need to reduce the opportunity for spread by swiftly isolating close contacts of those who test positive. If your child needs to self-isolate because they are a close contact of someone who has tested positive, they should isolate for 14 days. In this case, the household does not need to isolate unless your child develops symptoms. So what happens if there's an outbreak at your child's school? A coronavirus outbreak at a school is when there are 2 or more confirmed cases within 14 days or when we see a rise in the number of children absent with suspected COVID-19. The school will work with Public Health England and the Public Health team at Warwickshire County Council to manage the outbreak and provide support. Another question I believe you might be wanting answers to is how schools will keep the risk of transmission to a minimum. We are working closely with schools and advising them on what to do to reduce the risk of transmission. These include ensuring that social distancing is used at every opportunity, reminding pupils of the importance of good hand hygiene and regular hand washing, and keeping children in bubbles such as their form groups to minimize the number of close contacts they have. If pupils have to mix with children from other form groups for some lessons, it has been recommended that pupils and teachers keep seating plans, ensuring that we can identify any close contacts quickly. This makes our tracing of close contacts more effective and also means that fewer children need to self-isolate unnecessarily. We need parents to play their role, so if your child is unwell, please keep them at home. Get a test and if positive, inform the school. We will then need to work with you and the school to identify close contacts using class timetables and lesson sitting plans. And finally, we all need to remain vigilant by watching out for symptoms of coronavirus. Schools will do all they can to help children with their safe return to school. I hope that addresses some of your questions. Please talk to your child's school if you have any further concerns, and I hope that your child enjoys getting back to school. Thank you.